Whether you're a parent navigating myofunctional disorders or simply curious about optimizing your family's health, the Myohacker Podcast is your guide. Hi, I'm Karindy Ong, a speech-language pathologist, myofunctional therapist, and mom on a mission to bring holistic health to you and your family. Together, we'll explore whole-body connections and integrative solutions. Please subscribe and leave us a 5-star review to help other families discover this podcast. Content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Visit myohackerslp.com for free guides and access to my online community and courses. Now, let's dive into today's episode. All right, this question comes from a mom with a 14-month-old, and she said, my child has started hitting their head. Is this related to airway issues? So, great question. And when it comes to head hitting, this can look like, all of a sudden your child, they might actually be using their hand and hitting their head. What we see a lot is that kids will actually slam their heads against walls, and it can be very alarming as a parent, which is rightly so. But it is actually something we want to look at the cranial sacral system. And this child doesn't show signs. I know a lot of people listening are probably thinking, well, it's autism. And, that is something, for one thing, we tend to diagnose that later, but it truly sounds like there was a little bit, I asked some questions of the mom. There was a cold, and then following the cold, we had issues with sleep, issues with breathing. Then as she actually got better, that's when she started hitting her head. So I recommended, for one thing, that she start off with going to the chiropractor, and let's see if we can get, because they already see a pediatric trained chiropractor, they already see someone who knows her fascia system, knows what is going on in her body a little bit more. And I said, go ahead and get checked out there. Let's see if there is tension that is building up, because often when we see the head hitting behavior, it is a sign that we're trying to get some cranial sacral movements, specifically cranial movement. And so you might see that they're hitting because they feel like it's not in there. So if we can help them get the tongue up, so chewing will help. Chewing is a great way to give that input, just actually gently rubbing their head, and be mindful of their age, because, when they're little, those sutures are pretty wide open. We don't want to be handling their head. That's not what I mean. It's just gently, almost like you're brushing their hair aside. I love to give some input through the forehead, kind of like you're tucking your hair behind your ears. Just giving some of that input can help them if they're seeking stimulation. And then giving some of that oral input through chewing. Dependent on age, there are different things we do. But let's say if this is an infant, and an infant isn't likely going to be hitting their head, but if they, like this case where it's a 14-month-old, that they are hitting their head, they're younger and they're getting this action. They're trying to do that. We want to help them with chewing. We want to help them with movements. We want to make sure we check out those ears, make sure there's not fluid in there. That can also be it, that it's a vestibular seeking response, that they're trying to get some equilibrium and they don't feel good. And so they feel a really strong signal through the body, especially when there's fluid stuck behind the ears, that they feel that when they're hitting their head. So in this case, I said, go ahead and check in with your pediatrician. But in this case, I wanted them to follow up with their trained chiropractor to see if we can release some of that tension. We're going to increase the chewing and really getting that. And then, yes, it does need to be addressed from an airway perspective, because this child does have, through asking questions and different things, does actually have some oral dysfunction. So we want to get in there and get things moving. And she has had a tongue tie release, but in this case, she's built up more tension. So we want to open it up. She's also teething, which she's got some teeth erupting, so that can make it trickier as well. And we want to support that. Again, stimulation through the palate, that can always help with cranial movement. All right, another question. Is palate expansion necessary in all cases, or is that a case-by-case determination if that's a lot of case in this sense, what determines a good candidate for palatal expansion? Love this question. It is absolutely going to be case by case, and we want to make sure it's a functional evaluation. So it's going to be a team involved. We want to have a myofunctional therapist that is working with whoever is questioning if they need palatal expansion. And then you want to have a dentist or an orthodontist who works regularly with expansion, that this isn't their first time doing it. You want to make sure that they have done this quite a bit, because they'll be able to guide you more appropriately on what are those dimensions we're wanting, what is the growth. So we do have some dimensions that we talk about as far as like width, what we like to see. And we do want to make sure that the airway space, which is just going to be the top of the mouth, the jaws, we want to make sure that the tongue can rest mostly in the palate. It should be able to rest up there fully, but we want it to at least mostly be up there, because that is what gives our scaffolding to the facial muscles and bones. We want that to support, for instance, the nose. If you're getting a collapse in your palate, it's going to result in a deviated septum. You're going to have changes that we don't want. So we want to make sure the tongue can rest up in the palate. And we also want to make sure that we can breathe adequately. It can also be the case that expansion supports and helps give us more breathing space if we have enlarged tonsils and adenoids. This is something, if you're looking at tonsillectomy, adenoidectomy, that you might want to first, I would highly recommend first that you see someone who specializes in expansion, because if you can go that route, you might be able to address what is really going on. Now, sometimes that's not the case and you need to go ahead and surgically remove them. But first, let's see if expansion is what is needed. So does everybody need it? No, but most patients I am seeing nowadays do. And it could just be because of the demographic of people that I'm seeing. But I know this goes back to my discussion about, what has happened. Like, why are we seeing more tongue ties? Why are we seeing these changes? It goes back to what we're eating. It goes back to how we're moving, how we're not moving, all of these things. So something that is kind of fun is that if we are moving our bodies more, especially crawling, it's so important to crawl, guys. If we are crawling, if we are running around and playing outside and getting a lot of dynamic movement, this means a lot of movement, and we are getting outside in the sun, that you can actually be really pulling all of the muscles that are engaged with the jaw, with the shoulders, with the neck. It actually helps widen the palate a little bit. My brother, sister, and I all have tongue ties, but as a kiddo, I was a tomboy and I loved running and playing outside. I've mentioned before I was homeschooled, so I got to play outside a lot more than a lot of kids, than the neighbors and things like that. And I'm so grateful that my mom let me be a wild kiddo that was running around. I loved to run around on all fours, and I was fast, guys. I wasn't like weirdly running around. I was good at it. And the result is that it actually widened my palate quite a bit more than if you compare my palate to my sister's palate and to my brother's palate. Mine is actually the widest. And really looking at it, what did we eat? I actually didn't eat as well as they did. I had more texture aversions, and I didn't like meat until, I don't know, I was like 30 or something. It took a long time. So, I didn't like to chew hard foods. I didn't like to have that input. So I actually didn't eat as well, but because I was very physically active and moving and engaging my body, you'll feel it. If you pull and push your right hand down, you'll start to feel this engagement across your body. It actually widened and helped my palate get a little bit wider. And now, so that used to be sort of my suspicion. I know people are going to listen to this and be like, that's craziness. That's great. That's fine. You don't have to care. But I have seen so many kids that are playing outside, that are, their parents are going against the grain a little bit, and they're letting them do more of these big movements. They really are spending that time outside. I see that they tend to have wider palates. I'm not saying it's a guarantee, but it's free. You can get them to go outside. You can already do that. Back to palatal expansion itself. There are different types of expanders that you can consider. There are growth guidance appliances and tools. We also have the Myomunchie that it isn't an expander, but it's a chewing device that as you chew on it, it actually helps to form the arch. So it can be supportive of bone growth. It helps with bone density of the jaw and the facial muscles. Then, like I said, the growth guidance appliances and tools, those are great for the younger ages, and they really work more on the habituation of the swallow, of getting that tongue up, which is what is naturally supportive and growing of the face and the palate. And then we go to more like aggressive treatment approaches, which are definitely needed at times. So we have rapid palatal expansion, we have MSE, we have Vivos appliances, we have Homeoblock, we have different types of appliances that can do some of this expansion as well. There are pros and cons to every appliance out there. There's also the ALF, which is a more nuanced appliance, and it can promote that growth. But you'll see in a post I've done, and I'll probably touch on it here as well, that the ALF, it's what both my boys are in. I love it, but it's a more nuanced approach. It's not guaranteed that you're going to get expansion from it. However, as you unwind the body, unwind the cranium, unwind tension, sometimes a byproduct of that is widening of the palate and a growing of the airway. So all of these things are there, and they are options. It can be overwhelming to hear all of these things. So this is where it's so good to work with a provider. You can go find one and just say, hey, I listened to this podcast. She said not everybody needs palatal expansion. What matters is not everybody. Okay, guys? What matters is your kiddo. So bring your child to an airway-centric dentist, a provider who specializes in airway, and ask them, just say, hey, does my child need it? And before doing expansion, always recommend that you work with a myofunctional therapist, because whether or not you get expansion, you want to be able to use the tongue appropriately to benefit from that expansion. Otherwise, you can have relapse. We can have where we didn't get the tongue up in the palate. We didn't change our habits. And so we expanded and it looks like everything is wider, but then because we didn't maintain through our oral rest posture or through our swallowing habits, what can happen is you collapse in. So that's never what we want. We want to have maintained growth that leads to health and vibrance as we age. I hope you enjoyed this episode of the Myohacker Podcast. Remember, small changes can have big impacts on our overall health and well-being. If you enjoyed this episode, please take a moment to rate and review the show wherever you get your podcasts so more people can learn about the show. Head on over to myohackerslp.com for in-depth resources, free guides, and access to my online courses. You can also join the fun on Instagram at myohackerslp for bonus content and updates. And if you have questions or topic suggestions for future episodes, please send me a message. I would love to hear from you. Until next time, let's biohack myofunctional health as myohackers who change the world through intentional action and connection. Quick disclaimer. The content shared in this podcast is for informational and entertainment purposes only. The views and opinions expressed by the host and guests do not necessarily reflect those of the podcast or its affiliates. This podcast does not provide medical, legal, or professional advice. Always consult with appropriate professionals regarding your individual circumstances. By listening, you agree that the host and podcast are not responsible for any actions you may take based on the information provided. We encourage critical thinking and urge listeners to verify any claims or statements made during the show. Your mental and physical well-being are important to us, so please listen responsibly and prioritize your health and safety. Thank you again, and Myohack on.